Are you more likely to have a heart attack if you have mental illness? My name is Dr. Dutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about the importance of using lifestyle and metabolic interventions to target root causes of mental illness. And it's pretty well known that those who have mental illness are more likely to suffer from cardiovascular disease and to die earlier in life due to cardiovascular events. But I think it's important that we talk about association and causation. And what brought this to mind is a recently published article in JAMA Psychiatry looking at mental disorders as a risk factor for acute coronary syndrome, aka a heart attack. So this was a systematic review and meta-analysis that ended up including 25 large studies that consisted of over 22 million participants. So it's a pretty large data set, meaning that this is a potentially very high power study. And what it found is that depressive disorders, anxiety disorders, PTSD, and sleep related disorders all increase the risk of having an acute coronary syndrome, with PTSD and sleep related disorders being the most strongly associated. Surprisingly, bipolar disorder and schizophrenia were not significantly associated with an increased risk of acute coronary syndrome. So what this article suggests is that sleep quality likely plays a significant role in these cardiovascular events. So the question is it these mental health conditions, insomnia, PTSD, that is causing these cardiovascular events? That is just something we don't know at this point. But there are a few different hypotheses that we could consider when looking at this association, right? One is that it's insomnia and PTSD and anxiety and depression that is causing these cardiovascular events. Two, it's people who have worse cardiovascular issues who are at an increased risk of having anxiety, depression, PTSD, and insomnia. Three, there could be some other mitigating factor like medication. Maybe it's that the psychiatric medication that people are taking are increasing their risk of having a cardiovascular event. And in fact, a study that came out last year was postulating that SSRIs increase the chances of having cardiovascular events. And then lastly, although this is probably not the only other option, it could be that all of these things have some other root cause that ties them together, right? So there's something going on that leads to increased risk of mental health symptoms and increased risk of cardiovascular events. And that's generally where I tend to fall, which is that metabolic dysfunction is the root cause of both of these things. That metabolic dysfunction increases the likelihood of developing depression and anxiety, as well as insomnia issues. That metabolic dysfunction not only increases the risk of cardiovascular disease, but also anxiety, depression, trauma, insomnia issues. And there's also a bidirectional relationship there, right? If you have chronic stress due to insomnia and PTSD, you're probably going to get worsening metabolic dysfunction, which again is going to contribute to cardiovascular issues. All that to say, when you see an article like this that is showing an association between some health outcome and mental health conditions, keep in mind that this is an association and there are a lot of different ways that it can be interpreted. And certainly don't make any drastic decisions or conclusions based on just one article. Certainly meta-analyses like these are a good way to look at the conglomeration of evidence, but read the articles and don't be afraid to dig deeper so that you really have a better understanding of what may be going on. If you have any questions about this, then please put them in the comments below. Additionally, if you're interested in more direct content or resources from me, I do have an email list going and I'm sending out bi-weekly emails. So if that's you, then send me a DM with your email and I'll add you to the list.